maybe weren't able to attend are able to see the presentation here afterwards. We will also be sending out the PowerPoint and a lookbook at a later time. Look for that later on in the week. My name is Pablo Martinez. I'm the Assistant Program Manager for Workforce Development here at Los Angeles County Economic Development Corporation, or LAEDC for short. LAEDC is a nonprofit organization that serves Los Angeles County. Our mission is to reinvent our economy to collaboratively advance growth and prosperity for all. And at this point, it is my pleasure now to introduce the Director of Workforce Systems and Policy at United LA, Amber Chapman.
Good afternoon, everyone. It is so nice to see you all here. Kicking off the series of advisories for no better sector than the healthcare sector. So really grateful to start with this work here with you all. I am with United LA, as mentioned, Director of Workforce Systems and Policy. United LA is the convener of the LA K-16 Collaborative here in the region. And we want to just give you a little overview. Some of our partners here are new to this information. We want to make sure that we share it. So did you want to share the PowerPoint, Pablo, for us to all follow along?
Yes, I believe I have the PowerPoint up on the screen. Can everyone see that? The LA Region 16 Collaborative?
Yeah, it's up, Pablo.
Okay.
Can everyone else see? I know, Lance, you shook your head. Yeah, so Matthew?
Yep, I'm seeing it.
Okay. Amber
Okay,
might be
interesting. I don't see anything. So I'm going to assume we're on the same page. So it's like, I assume it says overview. Okay, there we go. The LA Region K-16 Collaborative is one of 13 such collaboratives across the state. The goal of the collaborative program is to streamline and accelerate pathways from high school to post-secondary education and into workforce. So for LA County, partners chose to hone in on healthcare, computer science, and engineering educational and occupational pathways to do so. Next slide. I can't see, so I'm just gonna, okay. We have a regional goal. We aim to close racial and gender gaps in post-secondary attainment and employment by building equitable pathways to healthcare, engineering, and computer science careers. Next slide. After convening a cross-sector group from K-12, higher education, workforce, employers, and civic partners, the region established objectives and strategies which were intended to leverage crucial transition periods in which students may not continue their education and imbue them with high impact interventions. And you see those objectives and strategies here. Primary objectives, we're looking at dual enrollment, strengthening transfer and articulation, and scaling work-based learning opportunities. Next slide. And this is just a demonstration of who our sub-regional partners are within the K-16 Collaborative. I'm sure your region is present here. They're made up of 5 sub-regional divisions throughout the county. They were established based on existing partnerships, school feeder patterns, and localized opportunities for students. So each sub-region established a convener to lead joint efforts that seek to meet our regional goal and expand upon our strategies and objectives. Next slide. So a regional stewardship group, which United LA convenes, was established to support sub-regions in their efforts, while also working to expand employer partnerships, to raise funds to continue regional work, and establish and maintain regional goals that current and future partners can contribute to through data sharing to relationship building. So that's a little about the K-16 itself. We'll have opportunities for you to learn more and engage if you're not already. What's next? We plan on having continued quarterly communities of practice where we'll address some of the regional objectives. We have labor market information reports that was done in partnership with LAEDC, which detail the healthcare sector, computer science, and engineering. So those are scheduled to be released soon. And for our other sector, we plan on having a similar program advisory. So if you're doing work within your region in computer science and engineering, look forward to that invitation. And thank you. Kicking it back to you, Pablo.
Excellent. Thank you so much, Amber. So next up, we'll have to present LAEDC's findings and data on the current healthcare industry in Los Angeles County. It's my pleasure to introduce Matthew Skyberg, our senior GIS research analyst working in our Institute for Applied Economics. I'll hand the floor over to you.
All right, thank you, Pablo. So good afternoon, everyone. As Pablo said, my name is Matthew Skyberg, and I'm with the Institute for Applied Economics at LAEDC. So today I'm going to be diving into the critical role healthcare plays in our economy and how the K-16 collaborative addresses systemic challenges to build equitable career pathways. So in healthcare, we focus on expanding access to education and career opportunities while aligning training with workforce needs. And this ensures that students are equipped with skills to thrive in this vital industry. During this presentation, we'll explore these transitions, workforce trends, and solutions to key challenges in building a stronger, more equitable healthcare workforce. Next slide, please. So Los Angeles County's healthcare ecosystem is incredibly diverse, spanning hospitals, community clinics, and specialized care facilities. One of the transformative trends is digital health technologies, such as telemedicine and remote monitoring. So expanding access and creating opportunities for workers that are trained in these systems. Next slide. The healthcare sector in LA County has shown remarkable resilience and growth. Between 2012 and 2022, the industry employed over 498,650 people, with payroll employment reaching its peak in 2022. And while there was a slight dip during the pandemic, the industry rebounded quickly and it continues to grow, particularly in outpatient care centers. So this reflects a broader shift towards more accessible and community-focused care delivery. Next slide. So between 2012 and 2022, healthcare employment in LA grew steadily. Ambulatory healthcare services are projected to add over 30,000 jobs through 2026. That's followed by over 7,400 jobs added in the nursing and residential care facilities. And this growth highlights the importance of building a workforce that's equipped to meet demand, especially in outpatient and community care. Next slide. So nearly 500,000 workers were employed in healthcare in 2022, as we said, and that makes it one of the region's largest employers. Women do make up 74% of the workforce, reflecting their significant contribution. Additionally, economic disadvantaged students rely heavily on healthcare programs as pathways to meaningful careers. And the median annual wage in this sector was over $70,400, and that highlights the potential for economic mobility within this field. Next slide. So nursing and residential care facilities experienced the most significant wage growth from 2012 to 2022. They had an increase of 18.3% over this time period. And that growth reflects rising demand for long-term care services and the critical role of these facilities in supporting aging populations. Conversely, hospitals saw a modest increase of 3.6%, while real wages in ambulatory healthcare services actually decreased by 6.7%. The decrease in ambulatory care wages could be attributed to shifts in employment composition within the subsector, such as increases in entry-level or part-time roles. So understanding these trends is essential for developing policies and programs that ensure competitive wages and attract talent across all healthcare subsectors. Next slide. So employers in the healthcare sector consistently highlight the need for both technical and soft skills. So nursing, case management, and mental health expertise are among the most in-demand technical skills. And soft skills such as communication, adaptability, and problem solving are also critical. And high demand roles like LVNs and medical assistants illustrate the importance of targeted training and workforce preparation to meet these needs. Next slide. Okay, so developing a robust talent pipeline is essential to addressing workforce shortages and ensuring that students are prepared for healthcare careers. So the K-16 collaborative leverages strategies from the state's Recovery with Equity Plan, which released in 2021. These strategies focus on retaining students through inclusive supports, increasing engagement for high school graduates transitioning into college, and expanding the capacity of basic needs centers to provide wraparound support. Additionally, increasing access for BIPOC and female students to mentoring programs and initiatives designed to foster a sense of belonging in healthcare pathways is a key focus. So by addressing these needs, we can create a more inclusive pipeline and prepare a workforce that reflects the diversity of our region. Programs like LA Care Health Plan and HealthNet play a key role in addressing healthcare disparities and promoting health equity, particularly in underserved communities. Next slide, please. So looking ahead, the future of healthcare will be shaped by transformative technologies. So telemedicine, AI, and machine learning will enhance care delivery and personalization, while genomic-based precision medicine will significantly improve patient outcomes. Additionally, population health management and community-based care models will focus on preventative care, wellness, and equitable access. So these trends are highlighting the importance of equipping workers with the skills to navigate a rapidly evolving healthcare landscape. Next slide. All right, so now let's explore the workforce within the healthcare services industry in Los Angeles County. This sector is not only a significant employer, but also one of the most diverse and dynamic in the region. However, challenges related to equity, representation, and skill development still remain. So in the following slides, we'll dive into key characteristics of the workforce and highlight both strengths and areas for growth. Next slide. So the healthcare workforce in Los Angeles County stands out for its diversity, especially in entry-level roles. For example, over 83% of nursing assistants and almost 75% of home health aides identify as Black, Hispanic, Latino, or Asian. However, equity gaps remain in leadership and advanced roles. So for instance, only 55.9% of nurse practitioners reflect the same level of diversity. And this disparity underscores the need for programs and initiatives that promote upward mobility and representation at all levels of the workforce. So gender dynamics within the healthcare workforce also reveal disparities. Women dominate caregiving and administrative roles, such as medical secretaries and dental hygienists, where they're over 90%, and medical assistants, where they're over 88%. And conversely, men are more likely to hold higher paying positions, such as dentists, where they're over 83%, or health technologists, where they're over 43%. Next slide. And as we look at the age and succession planning, older workers that are ages 55 and above dominate administrative roles. And that's presenting opportunities for younger, diverse entrants to come into the healthcare industry as these positions open. So entry-level jobs like medical assistants that are primarily filled by younger workers provide accessible pathways. However, equity challenges persist in leadership roles, emphasizing the need for more mentorship and targeted career development initiatives. Equity challenges remain significant concern in healthcare, particularly in leadership and specialized fields. While entry-level roles reflect strong diversity, leadership positions often have significant gaps in representation for Black, Indigenous, and Hispanic Latino workers. And this disparity stems in part from a lack of equitable access to education and career development opportunities. Many underrepresented groups face systemic barriers, including financial constraints, limited access to mentorship, and gaps in career readiness programs. And to address these challenges, targeted initiatives like mentorship, scholarships, and leadership training must focus on creating opportunities for advancement. So by prioritizing equity in education and career development, we can build healthcare workforce that better reflects and serves the diverse communities of Los Angeles County. Next slide. So the K-16 collaborative plays a crucial role in addressing these equity gaps in healthcare education and employment. By introducing healthcare career pathways to underrepresented students as early as K-12, and providing mentorship programs and expanding scholarships, the collaborative helps ensure that all students have resources and support that they need to pursue and thrive in healthcare careers. Next slide. So this table highlights the community college programs forecasted to add the most healthcare jobs in Los Angeles County. So CIP codes represent the national program classification, while TOP codes are specific to California. And these help align educational programs with the local workforce needs. So for example, nursing showing under SOC 291141 and TOP code 123010. That's a high demand occupation critical for hospitals and outpatient care. So they can use the occupational code and crosswalk that to their TOP codes and see what programs are needed to meet these occupations' demand. Programs for certified nurse assistants, LVNs, and dental assistants provide accessible pathways into entry-level healthcare roles, while specialized programs like community healthcare worker and alcohol and controlled substances address key gaps in preventative and behavioral health. So by expanding and aligning these programs, community colleges play a vital role in preparing students for in-demand healthcare careers while meeting the regional workforce needs. Next slide. So the healthcare occupations pipeline in Los Angeles County it's a critical component of workforce development. Community colleges and public universities are at the forefront of preparing students for high demand healthcare roles. Community colleges provide robust allied health and nursing programs, while public universities offer comprehensive healthcare education, research, and practical training. Programs such as internships, clinical rotations, and hand-on experiences are essential for equipping students with real-world skills. And examples of success include nursing programs with high NCLX pass rates in the National Council Licensure Examination, and allied health programs with strong placement outcomes. So collaborations with healthcare providers enhance relevance of training, and they create direct pathways to employment. And these efforts are vital for addressing shortages and ensuring that job readiness is happening in the healthcare workforce. Next slide. So in 2021, there were over 43,000 completions recorded in healthcare programs across Los Angeles County. And that represents a 21.4% growth over the last 5 years. So this growth reflects a rising demand for skilled healthcare workers, along with the responsiveness of educational institutions. Post-secondary education programs spanning community colleges and four-year universities are critical pipelines for meeting workforce demands across all skill levels. These institutions serve as key contributors to the development of professionals in entry, middle, and advanced level healthcare occupations. So to sustain this growth, it's essential to align educational programs with industry needs while promoting equity and access for underrepresented groups to ensure that this progress is benefiting the entire community. Next slide. So from 2017 to 2021, healthcare completions increased by more than 7,500 students in Los Angeles County, signaling a growing pipeline of talent to the healthcare industry. Equity remains a strong focus, as there's 53% of healthcare program students are Hispanic or Latino, reflecting a significant step forward in building diversity within the workforce. However, opportunities for underrepresented groups such as Black and Asian students should be further expanded. Additionally, females account for nearly 70% of the healthcare program enrollees, underscoring their pivotal role in this field. And efforts to promote equity, diversity, and inclusion must continue to ensure that all groups have access to career pathways in these high-demand healthcare occupations. Next slide. So this slide highlights the distribution of healthcare jobs in Los Angeles County based on their entry-level education requirements. So more than 31% of positions are low-skilled jobs requiring either a high school diploma or less. Example would be certified nurse assistants. Middle-skilled jobs, which make up 26% of the workforce, typically require an associate's degree or post-secondary certification. This includes roles like LVNs and medical assistants. And then high-skilled jobs, which account for over 42% of the industry, require a bachelor's degree or higher. This would be registered nurses and healthcare IT specialists. So to address workforce shortages, initiatives that promote career mobility, such as dual enrollment programs, stackable credentials, and apprenticeships are crucial. These pathways allow workers to advance their education and careers while addressing the growing demand for skilled professionals. Next slide. So this section focuses on the critical role of K-16 pathways in healthcare. By fostering seamless transitions from K-12 to post-secondary education and into the workforce, these pathways ensure that students are equipped with the skills and resources to enter high-demand healthcare careers. Next slide. So our report identifies several key findings for strengthening healthcare pathways, including early childhood exploration. So introducing students to healthcare careers early, starting in K-12, sparks interest and participation in programs that prepare them for these roles. And early exposure helps students envision a future in healthcare and build the foundational skills that they need for success. Structured pathways, so dual enrollment and articulated transfer programs, are critical for creating seamless transition from high school to community colleges and universities. And these programs reduce barriers to education and enable students to earn college credits while they're still in high school. And then workforce shortages. The report highlights significant shortages in high demand areas like nursing and primary care. And addressing these gaps through targeted programs can help meet the growing demand for healthcare professionals, particularly in underserved communities. Next slide. So there's two major employers in Los Angeles County that play a pivotal role in healthcare workforce development. Cedars-Sinai Medical Center, they're known for their advanced research and patient care. And they provide comprehensive medical services, and they serve as a significant employer and training ground for healthcare professionals. And UCLA Health is renowned for cutting-edge research and a wide range of medical services. And UCLA Health is a major contributor to healthcare advancements and workforce training in the region. And both these institutions highlight the importance of collaboration between education and healthcare providers to prepare these students for real-world challenges in the sector. Next slide. So the healthcare industry in Los Angeles offers diverse career pathways. Examples include clinical roles like physicians, nurses, and allied health professionals, administrative positions such as healthcare administrators and billing specialists, research roles focused on advancing medical knowledge through clinical trials, and health IT positions that manage healthcare data and enhance service delivery through technology. These pathways offer students diverse entry points into high demand careers. Next slide. So this table highlights healthcare occupations with the most projected job growth in Los Angeles County between 2022 and 2026. So low skill occupations like home health and personal care aides are expected to add over 6,600 jobs. These roles provide entry-level opportunities to workers with a high school diploma or less. Middle school roles like nursing assistants and medical assistants require some post-secondary education, and these are critical for meeting workforce shortages. And then we have high skill positions like registered nurses and medical and health services managers, which offer higher wages but require an advanced degree. And between these 9 occupations, over 52% of the projected net new jobs are concentrated just in these 9. So that underscores the importance of structured pathways to meet workforce demands. Next slide. Okay, so challenges in hiring and finding prepared talent. The healthcare industry faces persistent challenges in hiring and preparing talent to meet workforce needs. So in the following slides, we'll look at some of these key barriers. Next slide. So our report identified several critical challenges. Some of these are limited alignment between curriculum and industry needs, Education pathways sometimes fail to align with real-world healthcare demands, leading to mismatches in skills and workforce readiness. Insufficient work-based learning opportunities. So internships, clinical rotations, and apprenticeships are in short supply, especially in underserved areas. And this limits students' hands-on experience before entering the workforce. Then difficulty filling middle skill jobs. Roles like LVNs and medical assistants are in high demand, but employers are struggling to find candidates with the necessary certifications and soft skills. And then technological competence gap. As healthcare increasingly integrates technologies like electronic health records and AI, job seekers often lack the training needed to meet the employer expectations. So addressing these challenges require a targeted investments in education and a stronger collaboration between employers and the educational institutions. Next slide. So some potential recommendations from our report. The report did offer some actionable recommendations to address these challenges. So educational collaboration, that's strengthening partnerships between educational institutions and healthcare providers. Collaborative training programs and internships enhance students' practical skills and ensure they're job ready upon graduation. And then focus areas, investing in emerging fields like telemedicine, remote monitoring technologies, and integrated mental health services. These are areas that reflect current trends and unmet needs in the healthcare delivery. Then attraction and retention, expanding scholarships and loan forgiveness programs for healthcare students. Financial incentives help attract students to healthcare careers, while loan forgiveness encourages graduates to work in underserved areas, addressing critical workforce gaps. So by implementing these recommendations, we can build a healthcare workforce that meets regional needs while promoting equity along with innovation. And next slide. So in conclusion, LA's healthcare industry is growing rapidly, and it's offering significant opportunities for workforce development along with equity. However, we must address workforce shortages, skills gaps, and disparities collaboratively. So I want to thank you all for your time and attention today. If you'd like to explore these topics any further, if you have any further questions for me, don't hesitate to reach out. Contact myself at matthew.skyberg@laedc.org, or Shannon Sedgwick, our Senior Director at the Institute for Applied Economics. And we look forward to any further engagement. Thank you.
Thank you, Matthew. Thank you. Thank you so much for that presentation. We will now be moving into our roundtable discussion panel with our invited industry experts. I please invite you to stay muted throughout the discussion, this panel discussion. You can, however, submit your questions through the chat box, any comments or questions. Not to mention, we'll have an actual Q&A section after the panel discussion, which will be around 50 minutes. So today's panel will be moderated by our Director of Workforce Development here at LADC, Jose Pelayo. He'll be moderating our panelists of industry experts, and he will be fielding questions as well during the Q&A. It's my pleasure now also to introduce Carlos Lanese. He is the Senior Workforce Manager at the Community Clinic Association of Los Angeles County, where he plays a pivotal role in advancing workforce development initiatives. With a focus on addressing the unique needs of community health centers, Carlos oversees programs that aim to build a sustainable healthcare workforce. Pleased to introduce as well Adriana Carrillo. She is currently the Mental Health Clinical Supervisor for the Los Angeles County Department of Mental Health's United Mental Health Promoters Program. Adriana leads the department's largest program, which employs a community education model to reduce mental health stigma in underserved cultural and linguistic communities throughout Los Angeles County. I'm also pleased to present Jared Van Dapp. He's currently a project associate in the Office of Community Affairs and Government Relations at Children's Hospital, Los Angeles. Part of his role involves a program in CHLA called Careers in Health and Mentorship Program, also known as CHAMP, and provides young adults in Los Angeles a paid opportunity to gain practical experience and competencies essential to an entry-level career in healthcare administration. And our last speaker will be Robert Lopez. Robert Lopez is currently the supervisor of talent acquisition operations at the Keck Medical Center at USC. He has over 20 years of experience in human resources and recruiting within the healthcare industry. As a supervisor of talent acquisition at Keck Medical Center, Robert has been instrumental in streamlining recruitment processes and developing strategies to attract top-tier healthcare talent. And with that, I will turn over the floor to Jose.
Yeah, thank you so much, Pablo. I see all of the guest panelists here, so thank you so much for attending. I do want to prefix that for unforeseen circumstances, unfortunately, Robert will not be able to join us today, but we still hope to continue that partnership with USC. So very thankful. And again, as mentioned, I just want to start off by saying it's a privilege to be here with such an esteemed group of professionals who are shaping the future of healthcare. So very excited to kind of jump in and kind of have conversation, an important conversation in the state of healthcare, where it's headed, and how the K-16 collaborative can be a key partner in this transformation. So we heard Matt, kind of speak on some of the industry's challenges and, ranging from technology advancement. And one of the key components is workforce shortages. So this conversation, we hope to kind of get more involved and hope to kind of address some of those gaps. So with that being said, I like to begin by allowing each one of you panelists to kind of do a quick introduction and is kind of give a brief overview of the organization that you're representing. So I would allow Adriana, if you want to go first, the floor is yours.
Thank you. Good afternoon, everybody. Again, Adriana Carrillo, licensed clinical social worker with LA County Department of Mental Health. We focus on community mental health. And right now, our biggest lift is helping our unhoused homeless population, all ages, family, kids, adults, older adults. And that is where we're seeing the most need for direct clinical work staff. And so I'll be speaking more about that. Thank you.
Thank you, Adriana. Carlos?
Hi, welcome everybody. My name is Carlos Lanise. I work for the Community Clinic Association of Los Angeles, and we are a nonprofit with 65 community health center members, 114 service locations. And what we do is we really try to empower health centers to remain at the forefront of healthcare transformation, forging partnerships, innovation, and promoting equity and advocacy for the communities that we serve. We work pretty much as a conduit of different services to support the Los Angeles health centers and the needs of their communities. And I am the workforce manager. So nice to meet you all.
Thank you, Carlos. Jared?
Pleasure to meet you all. My name is Jared Mandap, a project associate here at the Office of Community Affairs here at Children's Hospital Los Angeles, the one on Sunset Boulevard. And CHLA is a nonprofit institution that provides pediatric health care, really with the mission to create hope and build healthier futures. Specifically, my department in particular focuses on a lot of our external engagement with CBOs, community-based organizations, and other external stakeholders where we can connect CHLA with the community. More specifically, my role here in the Office of Community Affairs, one of them is workforce development, and I currently lead our Careers in Health Mentorship program, as Pablo mentioned earlier. And it's really providing an opportunity for students from the college level, an early and entry level understanding of the different jobs here at CHLA. So looking to expand that and looking at future potential collaborations on what we could do more, but super excited for the conversation. Thank you, Jose and team.
Yeah, no, thank you, Jared. And once again, thank you guys for taking the time to participate. I think it's such an important conversation, again, addressing some of the data that was presented by Matt. So one of the key components and one of the major reasons why LA County is so big within the economy is innovation. So with that being said, the healthcare industry is it's definitely affected by innovation. So first question that I want to address, and it's kind of going towards Adriana. Adriana, you have over 17 years of experience in community health, so kind of want to hear your perspective, and then segue it to the other two panelists. The question is, what emerging trends in healthcare should the K-16 collaborative and subregions be aware of?
So for our department, the biggest shift that happened post-COVID is the request for telehealth services. However, for community mental health, the majority of our work is still in the field and it's still face-to-face with patients and clients. And I think the workforce, when I interview people, they really want to do all telehealth or like there's different mindsets on it. And there's a lot of telehealth happening online on social media and things like that. But for LA County Department of Mental Health and community mental health specifically, we still do face-to-face. We are still in the field. And so I think that's really important to orient students or folks interested in mental health, that there's different kinds. There's community mental health, and then there's like the private sector or the more like telehealth approach. That way they can pick which one they like and kind of approach the jobs in that way and be more effective with their approach. For us, again, in DMH, helping our homeless unhoused population is huge. And that's where a lot of our job openings are. So again, helping people, if their spirit is in helping the people in most need, empowering their community, healing the folks around them, then I think that's important to orient students. So I hope I answered the question.
Yeah, no, thank you so much, Adriana. And it's interesting that the panel that we have has different perspective, right? So it's very important. We have a lot of groups here in the LA County that do want to enter that field, and they don't understand that's also part of the healthcare industry. So thank you for that, and thank you for kind of honing in on some of the emerging trends. I'll segue it to Carlos to add some of the new emerging trends on his perspective.
Yeah, I mean, I could echo a lot of the things that Adriana spoke about in regards to telehealth and the expansion of mental health services in our community clinics. A couple other things that I've seen happen, emerging out is really a shift to value-based care, really focusing on outcomes, delivering, emphasizing roles such as like care coordinators, community health workers, and data analysis to ensure that the quality of care is there as opposed to the quantity that has been kind of the focus in the past. And with that comes a need for cultural competencies. So LA's population grows more and more diverse, more cultural, and so the more skill set that our workforce will have to kind of address those diversities, culturally, linguistically, and whatnot, is going to be very crucial going forward.
No, thank you for that. Jared, anything you want to add on your perspective?
Yeah, I just want to build off Carlos and Adriana for some amazing points. And I think location is also important. Speaking on behalf of my experience working with different college students and also youth throughout the LA County, you know, sometimes there's a misunderstanding if they're allowed to apply for certain positions or go to certain opportunities based off where they're from, their zip code. And I think we have to unify together to share all these opportunities no matter where they're living and no matter what school they come from. I think that's also an important point to add on as well.
Oh, thank you for that, Jared. So another question, and I think this is very important because we did see in the report there's projected to grow 42,000 jobs through 2026. And we know based on feedback from industry and the report that there's workforce shortages. So question two, and I want to stay with Jared, in what areas does healthcare industry face the most significant workforce gaps or growth? And how can we address those through targeted education and training? In your perspective?
Yeah, thank you for the question. And speaking through a healthcare administration lens, I think a lot of the growth I've seen and with some of my team here is public health, healthcare administration, public policy, and noted earlier as well, a lot of data analysis and understanding the different healthcare trends that students need to understand as well, social determinants of health, and trying to introduce that early on. But in terms of addressing these types of gaps, the technology has really shifted the type of skill sets that students have nowadays, right? And it's also affecting the future of healthcare professionals. Education is really important, and I think providing and creating early and entry-level healthcare focused curriculums to expose students to different careers and pathways, and also maybe creating relationships with other team members from different industries and having them meet, oh, I don't have to be a nurse or doctor. I could work in different departments. I didn't know this is available, and just formulating relationships and not shying away from what's out there once they kind of enter and think about their career.
No, those are great, input that you mentioned. And the K-16 collaborative, one of the major components is work-based learning and starting at a younger age. So glad you touched base on that. Carlos, so the question again is, any significant workforce shortages or growth that you see from your perspective, and how can we address those gaps through education and training?
Yeah, absolutely. Thanks for posing the question. As at CCLAC, we run a resume bank and a job board for all 65 of our community clinics, right? So I see a lot of the jobs that get posted and continue to get posted or posted quickly and often. I've noticed significant, interest and need when it comes to a lot of the allied health fields, right? So medical assistants, licensed vocational nurses, mental health workers, of course, as well as primary care providers. Some stuff I've seen growth in has kind of been in data analysis and health IT specialists and care coordinators. And I would say, some of the best solutions to doing it is through pipeline programs early on, like discussed. So some of the stuff that we're currently focusing on developing are apprenticeships, kind of developing an earn while you learn models to kind of meet demand right away. Any sort of accelerated opportunities that are out there with education to really fast track programs into these high demand roles. And then, off of what Jared was mentioning, focusing on that early exposure and aligning curriculum, right? I think that's a really big thing to ensure that gap is as closed as possible so that the entry level workforce can kind of really make an impact early on and have good experiences.
Thank you, Carlos. Adriana?
So one of the things that I think would help is whenever you talk about healthcare, also add healthcare and mental health care, because not everybody automatically thinks mental health is part of healthcare. And here in LA County, we've got two departments, Department of Health Services, Department of Mental Health, and then we have Department of Public Health, so they're all kind of divided. Plus, for a lot of students, the word mental health might have some stigma associated to it, and they might not even consider approaching a career in mental health because I'm not crazy. I don't want to work with the crazies, right? But if you have it on your curriculum or in your written material, at least it'll prompt someone to ask more about that career path and have some dialogue, and maybe some myths can be dispelled. So I really encourage anybody who writes healthcare to also / mental health care. But for us, we have a great need for clinicians, licensed clinical social workers, marriage and family therapists, psychologists, psychiatric registered nurses, psychiatrists, especially people who come from underserved cultural and linguistic communities, because those are the communities that our department is reaching. So we need that subject matter expertise on the clinical side. The department has opened up a lot of positions for community health workers. Our community health workers don't need to have a high school diploma, and it's a great entry level job for this direct clinical work. And a lot of the folks that I've interviewed that were interested in community health worker wanted to have higher education, but they just couldn't afford it. And so the department does support community health workers who are interested in pursuing higher education, their bachelor's, their master's. And we've seen a lot of success with underserved, underrepresented staff, like go up the pipeline and the career path and like become clinicians. And like they're a great asset to our communities. I oversee service area 6 and 7, so the South LA area, the East South LA area, and that's where we're really trying to build our workforce through these different job approaches, these pipelines. So that's kind of my spiel. Thank you.
No, that's great feedback. One of the consistent things I heard from the three panelists is the need for bringing awareness across all 88 cities in LA County, and the need to bring it at a younger age. And I also heard, different needs in allied health, clinicians, and then on the policy and admin side. So it's great to hear that perspective. I kind of want to stay in this question and kind of dive deeper and maybe go back to Carlos. You mentioned you kind of oversee and work with 64 clinics across the LA region. So I know we mentioned on specific roles and occupations that have some gaps, but Curious to hear your input on what certificates or credentials are mostly needed by the organizations that you work with, and how do we address those demands?
Yeah, I mean, I would, consider a lot of the, certifications in the programs I was talking about earlier, certified medical assistants, behavioral health technicians, telehealth and health IT certifications. Also on the degree level, BSN for nursing roles and other health informatic credentials. Dealing with a lot of like the essential skills that are out there that are going to be revolving around electronic health records, as well as basic skills for like frontline roles. And then again, going back to the telehealth tools and virtual care delivery. But then I think one thing's also missing a lot sometimes is we focus a lot of times education on the clinical skills and that sort of thing, but the soft skills are extremely important, right? When we're talking about cultural competencies, providing a experience that people want to return to, right, is kind of important to keep pursuing healthcare, right? So communication skills, empathy for patients, critical thinking, those types of things, and cultural sensitivity are really important. So I think like how do we solve that sort of thing? It's obviously there are a lot of institutions out there that are teaching those clinical sides of things, but if we're looking at really preparing individuals for these careers, the soft skills are going to go a very long way. So I think that looking at finding ways to balance some of the certificate programs that don't necessarily focus on those types of things would provide for better experience for the learner, for the health centers, and as well as the patients that come across those things.
No, that's a great points, Carlos, and you read my mind because that was my next question, but glad you answered that and touched base on that and the importance of that. Jared, same question. Certificates, credentials that you see are most in need in your current organization. You can also touch base on some of the soft skills and technical skills that Carlos kind of mentioned. So, your
Yeah.
feedback?
Thank you, Jose. I'd love to touch upon like the healthcare roles as well. I think in the non-clinical sense, I've been noticing and collaborating with some of our HR team members here at CHLA, office managers, administrators, representatives, project managers, coordinators, assistants. These are a lot of roles that not a lot of students and youth know about, and it can really help them build their resume, build networking, and give them a chance to learn from other mentors. And with the types of soft skills and technical skills, Carlos touched upon all the great ones, and I think emotional intelligence especially is a really big one. And understanding the people around you and how to navigate and control, and it touches upon Adriana and mental health and making sure everyone's doing okay. And I think as well, with the aspect of making a workplace of choice, having that workplace of choice and teaching this early and having that retention rate go higher with all these early and entry level career young professionals. And in terms of technical skills, I've noticed that it's so simple, but writing emails, understanding the context when you're speaking with somebody. I'm sure all of us use Teams as well, and understanding how to use Excel or Microsoft Office on the technical side, database, file management. Like these are all big skills that can be taught early on through different courses. And of course, whether it's us creating that type of healthcare focused curriculum that was mentioned earlier, I think that could all play a big role.
No, thank you. Great points. Adriana, would love to hear from you. I know you lead one of the largest departments in the county within DMH, so kind of want to hear your input on that.
Yeah, our community health worker position doesn't require any special certification or credentials, not even a high school diploma. But once they enter the department, we do support them in getting their Medi-Cal peer certification, which is a new certification for this workforce. And then from there, we have medical caseworkers. So bachelor's level kind of gets you to that position. And then from there, there's clinicians, social workers, marriage and family therapists, psychologists, psychiatrists, psychiatric registered nurses. So that's kind of like the pathway forward. We also have other admin positions, but our biggest need is like the direct clinical work. So that's kind of where we're at.
No, thank you. I think the next topic is very important. One, we have roughly 9.6 million residents in LA County. Out of that, roughly 15% are still living under poverty. So we have to do as a region a better job of building DEI strategies. So with that being said, within the healthcare, how can we adopt and attract diverse range of students? And how can these pipelines be structured to ensure equitable access and inclusion throughout the journey within healthcare? I actually would like to go through Jared first, because I know, Jared, you also have a guest intern as well that you might want to kind of touch base on. I know you mentioned that, so the floor is yours.
Yeah, thank you so much, Jose. And to kind of touch upon the question first, I think, working in collaboration here in community affairs, we work with a lot of different community-based organizations and try to partake in a lot of different in-person events, meeting families, meeting youth, the teachers. I think building that relationship is very important in regards to partnership as well. And I'm super big on mentorship programs with students and understanding the desired fields or career interests that they have. And also, early exposure to different DEI strategies like Jose, Carlos said, cultural competency, social determinants of health, health equity, introducing that can go a long way. In terms of attracting a diverse range of students in healthcare, I specifically run the Careers in Health Mentorship Program, which is an early entry level opportunity for students. And I actually brought one of my interns with me who's working alongside me. His name's Ivan Bustos. He's currently a CHAMP intern right now through December, looking to extend. And we're also working with him on trying to find another position here at CHLA outside of an internship. So Ivan, if you want to introduce yourself just briefly and where you're from and what you're doing in school and what got you into the program.
Awesome. Thank you, everyone. So yeah, I just want to go ahead and introduce myself really quickly and echo the importance of that exposure at an early part of anyone's career, whether it be in a clinical or non-clinical setting. I finished my undergrad in health science and originally wanted to go into a clinical path until I learned about healthcare administration. Decided to do a year in higher education, and then I'm currently now pursuing my master's in healthcare administration and also complementing that with my internship here in the CHAMP program at Children's Hospital of LA. Has been a great experience working with other leaders and networking. I think early in my career, that's something that a lot of students my age, a lot of students that are trying to get into healthcare seem to not really understand is the importance of networking and continuing to educate yourself in a career-based platform, right? It's one thing going to school and another thing finally getting to immerse yourself into a work environment and culture. And there's a lot of professions and careers out there that I'm still learning, that a lot of my peers are still learning. So that definitely is one of the regions that will continue to grow in healthcare as we need new, members of workforce within hospital settings, clinical settings, public health, and all of the above. So very excited to be here today and listen to all the panelists and the discussion.
Thank you, Ivan.
No, thank you, Jared. Thank you, Ivan. I think we all can agree that you have a very bright future, and it's good to see a young adult in the healthcare industry. So very excited for that. Carlos, we'd love to segue the question to you, DEI strategies, and how can we implement that? How can we do a better job?
Yeah, absolutely. I think it's very important. CCLAC is an anti-racist organization, and everything we do is with a Jedi lens, right? So, that starts with just ethical storytelling. That starts with, how our flyers are promoted and the language that we're using, right? It needs to be something that I think organizations just really adapt to and adopt and live and breathe it, right? Because as ingrained as it is in you, then it will be in the efforts and the work that you do. So I feel like when it comes though to pipeline programs and different strategies, it's just really focusing on from my standpoints, right, on the recruitment side is recruiting from those underrepresented communities, make sure there's mentorship, tutoring, financial support, stuff that are going to help eliminate those barriers that we know exist. Instead of speaking about it, pick some action behind it, right? To actually help eliminate those barriers. And then, again, when you're looking at developing different strategies, it's making sure that the curriculum, again, is culturally responsive, right? Making sure you're partnering with schools that are in underserved areas and offering, a lot of our programs, we offer incentives and scholarships and whatnot, right? And stipends to kind of help the financial barriers that individuals might come across to get involved in these programs.
No, thank you for that. I think one of the biggest components that Matt mentioned was it wasn't quite shocking, but 74% with a gender is female that's represented in the healthcare, and I think Hispanics represent over 50%. So there's definitely a lot of work that needs to be done to build equitable access and bring different demographics into this industry. So, Adriana, I know you mentioned 17 years of experience. We'd love to kind of hear your input and your thoughts on that.
For my current program, we've made it a point these past 4 years to hire locally. So the service area that you are working in, we like recruit from there, and then hopefully, they get on our list and we're able to hire. And we're really trying to make sure our team represent the community that they serve. And we get a lot of success that way because people are committed to helping their community. And you run into some of the folks you're helping at the grocery store. So now there's like an extra support that is felt in the community where they can go to people locally for support. So that's how we're trying to increase our culture and diverse workforce by hiring locally and encouraging folks to continue on like a career path if they want to, and also just having a flexible work schedule so that they can do school outside of work hours or accommodate some of the work hours to help. I have right now a clerk and she's doing her bachelor's, and so she ended up with classes on a work day, so we had to like adjust her work schedule and like support her through the process. But her goal is to be a clinician and she'll be great clinician. So we really want to have that flexibility to really increase the diversity in our workforce.
Thank you for that. I mean, those are great, things that your organization is doing to adapt and build equitable pipelines. So thank you for that, and thank you for the rest of the panelists. We'd love to segue to another conversation and most important topic I think that all of you addressed since the beginning of the conversation, which was bringing awareness at a younger age. So I would like to stay with Adriana and kind of get your perspective on how we can strengthen partnerships between healthcare employers and our K-16 initiative and institutions overall in LA County to create more work-based learning opportunities to then build, again, equitable pipelines.
I'm a big proponent of like career day fairs and having some of our mental health workforce go present to kids, the younger the better, to like really expose them to career paths in mental health. A lot of us in mental health kind of accidentally found it. Like we were really guided by people to be an MD or like more in the healthcare profession versus mental health. So really partnering with the schools to do career fairs, to like have them come to work and look to see what we do, or encouraging the staff at the schools who are like counselors or mental health providers to share what they do and like let the kids ask questions. So just a lot more exposure.
No, thank you. And that's one component of work-based learning opportunities. So would love to hear more on your side, Carlos. I know you mentioned mentorship was a big one, but overall from your perspective and working with over 64 clinics, how can we strengthen our partnership with employers?
Yeah, I mean, that exposure and outreach, that's number one on the list. So that was taken by Adriana for sure. But because even with our membership clinics, right, we have all these resources that they're not even necessarily aware of, right? And when we hold meetings, they're like, "Oh, do you guys do that? Wow!" Right? And it's like, "Yeah, we've been emailing about it, right?" So, but getting good strategies out there to ensure that people are knowing about it and aware of it is number one. But I also think like there's a lot of professional partnerships out there that can really help establish kind of opportunities to leverage strengths, right? So for us, like advisory boards are a very big thing. Getting people together, like for example, I am Area Health Education Center director, so we hold an advisory board for that, where we're bringing organizations, government officials, schools, and health centers together, right? And a lot of times, of course, we want to promote our pipeline programs, but it's really important that there's a discussion going on between those in the room, because there are probably a lot of opportunities that can be solved by those people that are involved in that room that aren't necessarily CCLAC goals and metrics and whatnot. So I think that's really important to ensure that you're partnering. And then I would also say in partnering, big success that we had this past year is working on some co-developed programs that are out there. So We work with a group called Propel America. We've had pipeline programs. We recruit, right? We're out there, but we are who we are, right? We have the manpower we have. So we partnered with a program that offers free MA education, and we partner with them to provide the clinical hours in our health centers. So it's kind of coming together with that like synergy to kind of really co-develop and just design these programs and whatnot to really kind of leverage each other's strengths that are out there.
Thank you. Jared, any additional feedback?
Yeah, I just want to build off Carlos and Adriana and focusing on initiating conversation and continuing it outside of emails and going in person. And both of them touched upon, I think sharing trends and potential programs or co-developing programs or projects or ideas so we can create more collaboration. I think during the school year, even outside of the school year, just having that consistent engagement with each other. You have a program, how can we be a part of it? Or we have something, how can you be a part of it? And just finding that bridge and cross section. I'm a big advocate for community, and I think having a space for where the community and teachers and students can share ideas and interests in what they want to do every year. How can we make it more fun, and how can we all collaborate on just the big initiative on increasing the workforce?
Thank you. I want to keep it here still and open it up to any of the panelists, no specific order. Are there any specific mottos at your organization or that you've seen that are implemented that are very successful? I mean, whether it be internships, apprenticeships, clinical rotations, and then if there are, is there a way that we can scale that up as we know that LA region is very vast? So open it up to either Adriana, Carlos, Jared, anyone that can touch base on that.
For our Department of Mental Health, we have like a structured process for like the master's level positions. And schools have MOUs and they have internships that are like a whole academic year long process. We're not as effective with like other positions. And I think that's an area of growth. So it really comes down to like the individual program if we want to have some interns coming for the different levels. But as a department, I think in the last year, they've been working on like different strategies to recruit like different level positions. But for like master's level, we have like a structured process with the social work schools and the doctoral schools. Yep.
Thank you for that, Adriana. And I think you brought up a great point, and I want to address that as a barrier because, we are focusing on these great programs and, that's great that it's for the master's programs. But if we want to go back to building equitable pipelines, we also have to take a deeper dive and focus on, youth that don't want to take that 4-year path, that want to take a certificate path, a 2-year path. So, I commend for the work that you do, but I think with this collaborative, I think there's still a lot of work that can be done, and they're hoping that conversation continues and then we can build that partnership. But thank you for that feedback. Carlos, anything that you've seen across the clinics that might work? Any specific motto? I know you mentioned some of the work that you do with Propel, but we'd love to hear your input.
Yeah, well, pipelines are what we do here at CCLAC. Internships tend to be pretty successful for us. Our allied health internship last cohort, I think we had 40 participants, over 20 health centers, and I think 15 of them got jobs at the end of their opportunity there. So that's one of our successes is our allied health internship programs. We found success in our AHEC Scholars program as well, which is kind of similar as an internship program, but they're also doing about 40 hours of didactic learning that they will learn about community health, the history of it, kind of really the overarching impact and whatnot. And we also run an AmeriCorps program for community health worker and with outreach and enrollment and education. So those are just have to be a high school graduate, no experience in in healthcare kind of leaning into it. So we find that to be pretty successful. And, again, we're hoping right now we're developing an apprenticeship program, right? And that we're hoping, scalability and with the challenges financially to find ways, but we're convening with our member health centers to really get that feedback of what the opposition might be to running a program like that, so we can design one that makes it easy to be digested and like accepted. But yeah, I would say our internship programs do really well. And again, our AmeriCorps program, which is a full-time year program, seems to be rather successful. So yeah, that's what we got.
Thank you, Jared. I'm not sure if you have anything to add. I know maybe touching base a little more in depth with the program that you're leading.
Yeah, so I guess, in terms of what work-based learning models work, I think internships, apprenticeships, mentorships, all that work in terms of CHAMP. We have also other internship programs that I don't lead, but I work with or collaborate with other departments here in the enterprise. We have one called CAMP CHLA, which is for high school students. We have LA HIP, which is for early research students. We have other organizations that we partner with on specific corporate work study programs. And I think how we can scale them across the subregions is, the involvement of our healthcare leaders within each of the different specialty care clinic centers that we have all over LA County. And I think also, with all the different programs that we have and all these different departments that run it here in my department, we're trying to really create and cultivate a hub where we can have all these internship programs feed off each other and create a specific pathway for students that maybe want to come back to the enterprise and learn about, I'm in this stage of my education. I want to come back and see what's available and provide that opportunity for them. And how can I also incorporate other team members that want to be involved with professional development, work-based learning models, and just want to give back to the community as well.
No, those are great points by all of you. Thank you. I think the next question I want to go back to Adriana, because you made some comments earlier, but we understand here as a region, and hence what we're doing here as a collaborative, if building those partnerships with industry, because it's very, very important. But we know we are a vast area. We know that different organizations, educational institutes at times want to reach out specifically to employers. So I guess my question to you, Adriana and panelists, is what challenges do you face in offering work-based learning opportunities? And if any, how can we better support?
So I forgot about our youth worker program. So we do have different like internship kind of, workforce development programs. And we do have a position youth worker that recruits high school students. So I completely forgot about that. It's a LA County wide opportunity. And every department will utilize youth workers depending on the specialty for that department. And there's different kind of student worker positions. I think the biggest barrier is ensuring that when we have the student worker come, that we give them a valuable experience. So making sure our curriculum stay up to date, because we have great opportunities and sometimes it takes us a while to catch up with the times. So I think that's one of the things that we can improve on and continue, like making sure all that technology that is needed is there in the student experience. I think that's like the biggest one. Sometimes the county work moves slower than what's happening in the field.
No, that's actually a great point, and we understand, might be different things that they have to get through, but that's actually a great point that you bring up. Carlos, any challenges that you see why we're not, maybe doing more of work-based learning, and how can that be addressed?
One of the things I see mostly is resource constraints. A lot of times financially, right? We deal with a lot of FAQs, right? So it's I would say leveraging partnerships, finding ways to find shared funding and infrastructure support goes a really long way to kind of solving that. And then also, that just involvement and excitement around preceptorship, I feel can also be a challenge for us. So we might have a health center that's interested in doing a program, but can't motivate their staff to do that extra work, right? To understand the bigger picture of what preceptorship is, how it's an opportunity to build your own internal like skill set, right, and kind of differentiate yourself as a leader, and then the impact it has, on your industry overall. So I think, to me, those are some of the biggest things that I run into is that, there's a lot of people on the front end that really want to do these programs, but then, there's some financial concerns as well as like, just staff shortages in general that can make it difficult to take it on right now. They know the importance of it, but they're kind of a little bit worried about what's right here in front of them.
No, that's actually a great point. The shortage of staff and then with added responsibility, I think that's also a big barrier of why we're probably not able to partner up to the extent we would like to. So, Jared, we'd love to hear from you. I know you mentioned some great ideas that you had going on at CHLA and the hub, but kind of want to hear more of your thoughts.
Yeah, I think Carlos hit the nail on the hammer. Is, resources and financial constraints. I would love to, and I always talk about with the team is expanding programs to certain hard to fill positions, right? Earlier, we noticed an increase in IT and data entry. Why not have specific programs catered towards that, right? I run Champ. Why can't I? I would love to do Champ IT, Champ HR. Interviewing students. Every year we notice the trends in these types of careers and the complexity and uniqueness of jobs that are matching up with degrees. So how cool would that be is to try to find an opportunity. So that's one of the biggest challenges I face is wanting to create specific programs for hard to fill positions.
Again, thank you so much for your comments and your honesty and bringing some of these barriers. That's why we are not able to offer work-based learning opportunities to the extent that I think it's needed, specifically in diverse communities. So I want to segue back to another question that I think is in everyone's mind. And of course, you probably already are guessing it involves technology and specific AI. So artificial intelligence, it's here to stay. There's different perspectives about AI, but kind of want to hear your input on how that's already affecting some of the work that you're currently doing in your role, that you see around your organization, and then any future trends and skills that you see that might be needed by these young adults coming into the industry. And maybe we can stay with Jared, because I saw you nodding your head, so I think you definitely have some input on this.
Yeah, I think for me recently, for this Champ cohort for 2024, through my experience, I had over 250 applications from students all over LA County, and one of my colleagues and I were looking over personal statements, and we can already see certain responses have similar trends, and I think being able to using the trend of AI and how can we educate and implement that with the students now and have them not be so reliant on it, but as a tool to be helpful, right? So just as other programs came about, through the course of the evolution of technology, AI is, like you said, here to stay. So how can we start to implement that with the students now and have them use it more as a tool instead of something to rely on?
Do you, and I want to stay with you, Jared, do you see that across different departments being utilized in different, roles? Your thoughts on that?
Yeah, thank you. Totally missed that part.
No worries.
I think in terms of the different departments, I definitely notice it with different team members and having them and even share with me, like, if you use it like this, you can get the types of ideas and brainstorming. And, it's sometimes we just get burnt out, writing the same email, writing the same goals and deliverables. And we just need something to refresh our mind. And I think that's the type of ways that we've been using it. And sometimes when we hit that wall, we just need something to just push that wall a little bit further so we can kind of peek over it. So that's just my personal opinion and experience with it.
No, thank you for that. Thank you for sharing. Adriana, I would love to go to you and see how, from your perspective in the work you do, if you see it's, already being implemented in different roles, the future of it, and then your thoughts overall.
So I know our department's trying to block it when it pops up on our different updates. But I have seen it used in our stakeholder meetings when we do them virtually, how AI can help with translation or especially people that are hearing impaired or visually impaired. And making things bigger and louder, and like just different technologies that really kind of helps our clientele who have ADA needs. That's kind of how I've seen it. I haven't really seen it like used in any other way. But I can resonate with Jared about like job applicants, how like you start seeing the trend, or you like question whether it's really them or AI. And so for us, like doing in-person interviews are important to try to kind of tease it out, but it does kind of make you rethink things.
Definitely. Thank you. Carlos, I'm sure you've heard some good stories from your clinics.
You know, it's really something that we're just kind of like addressing right now, you know, because I feel like sometimes, you know, maybe similar to the county, we lag a little bit, right? It's been out there for a while, and we're trying to kind of catch up to trends and whatnot. So, like, I know, and I'm probably going to learn a lot in this next one. We have an HR roundtable where we'll have a presenter kind of talking about all this AI stuff, and kind of really how we can harness it. Because in my personal opinion, it's, you know, it's one thing. I think we got to lean into it. You know, it's here to stay. You know, everything has a good and a bad side to it. You know, personally, you know, I do try to leverage it as much as I can, as I'm looking to research topics, as I'm looking to, you know, understand things that maybe my experience yet hasn't shown me, right? So I think it could be a good tool. Obviously, relying on it, you know, it's a crutch. You know what I mean? It could definitely be a crutch at that same time. But yeah, we're really just right now starting to have that conversation with health centers and whatnot. And so, you know, I don't have as much feedback as I would like to, but it's definitely top of mind, and it's stuff that we're starting to involved in now.
No, thank you. And I see your hand, Jared, raised, so I'll go to you right away. But I bring it up because, you know, in the data that Matt presented, we see technological advancement being a different way of doing, you know, health services, telehealth, you guys mentioned. So I think it's here to stay, and it's going to be a big component. Just kind of wanted to hear your thoughts on where it's at currently within your organization. But Jared, I know your hand was raised, so.
Yeah, I wanted to add on because my intern gave me a ping because he's in this career set and this career path, and he was mentioning to me that, who knows later down the line that AI could create new jobs, right? AI product manager, AI data analysis, and who knows where it'll be 30, 50 years from now. They could just be as normal as Microsoft Word, right? So I just wanted to plug that in there, and hopefully the trend will be for the better, and the future of workforce, and for the employment of the youth.
No, I agree. I agree, Ivan. We don't know where it's going to be in the future as innovation expands rapidly, but I think it's a necessary skill to have in your resume. I think it's being utilized across different industries, and definitely it's impacted health and will impact health. One last question, and I'll open it up to each and every one of you before we jump into opening it up for a Q&A, which I'm sure our audience has a lot of questions ready. If you don't, make sure you have that ready. But the question is, it's pretty simple, but yet a very loaded question. How can we, and we being LA County, the K-16 Collaborative, better partner with each of you as an organization to enhance some of these barriers that were mentioned, to bring different opportunities? So love to open it up to anyone to begin with, but how can we partner up better and make it more effective?
I guess I could start. Oh, sorry, Carlos.
Oh,
I
go
just
ahead.
cut you right at the.
No, you spoke first. Go for
I
it.
think, in my experience, just conversation, engagement, and following up with these types of conversations. What do you have going on? How can we help? How can we assist? There's many people here I've never met before. I would love to meet and start types of conversation and share with you, the types of programs that we have going on or what we want to build. We want to create this hub where we can also include external partnerships and collaboration opportunities and just build community. I think workforce development and workplace of choice and workplace retention are growing trends that we see entering, 2025. And I think just that exposure through also in-person conversations, and also bringing students in to provide their own perspective, is also a big point as well.
Perfect. I should have spoke because you took everything I was going to say, Jared. But anyway, but yeah, that's really what it comes down to. You know, a lot of times meetings like this, you know, energize, galvanize. It gives an opportunity to break away from our regular day, and you know, thoughts start to, oh, we could do this, we could do all these things, and then we get off the call and we bury our head back into the sand, right? So I think it's really important. You know, all of this really revolves around relationships, really revolves around partnerships. You know, as a nonprofit, you know, everyone has resources and you know, capabilities, and I think if we had, you know, more capabilities and more resources, we would do more good, right? And I feel like you know, everyone could probably on this call can realize there's opportunities out there that maybe, you know, we thought about or haven't taken the step for, or feel like we don't have the capacity to take on, or whatever it might be. But once we do it, it lightens our load like down the road a little bit, right? So I just really think that continuing the conversation, continuing engagement, and just keeping, you know, a couple priorities top of mind, but again, keeping that just that collaborative effort together, right? Like supporting each other in these types of meetings, supporting each other's in advisory boards, showing up for each other, right? And then, you know, almost on mistake, we find opportunities, right? So we're all kind of like-minded, thinking about serving the same population. And, you know, there's a ton of expertise. I'm sure a lot of individuals could take my place and speak here today, right? So getting to know those individuals, understanding and leveraging those partnerships are very important.
Adriana?
Yes, I think I agree. Keeping the network going outside of this meeting, calling each other, reaching out to each other. There's like written tips of the trade, and then there's also the unspoken tips of the trade that require a phone call that can't be written down. So, you know, keeping those relationships going are important, so we can help, you know, the work that everybody here in the collaborative is doing to develop the workforce, and then also how to get into the workforce. Like for LA County and for these type of government jobs, there's a civil service process that can be very demoralizing to students if they don't know how to fill out those applications. And it's also hard for the helpers, because if you haven't worked here or applied, it's also hard for you to guide them. So we're a resource here for you, and feel free to reach out.
Thank you. I think one key word for me from all of you guys' comments is a partnership, and not just a transactional relationship. You know, a partnership that benefits both ends. So I think that was, and I think Carlos, you mentioned that. I think that was a key component of understanding that. With that being said, before I open up to Q&A and the audience, if you do have questions, please feel free to raise your virtual hand. And then I'll go down the line. If there are no questions, there are questions that were inputted when you registered, so I can kind of go off that. But I would advise in an effort to build this partnership to unmute and then raise your hand as well. But last thing, panelists, anything you guys want to add, any events that are coming up, anything that your organization's doing that we can assist with, please feel free to unmute and share.
Yeah, we're recruiting. We're recruiting for applicants for our internship programs, our allied health programs. We're still looking for individuals to join our AmeriCorps program. So if anyone is interested in you know, getting their if their students some exposure, some clinical hours and whatnot, would love to discuss any opportunities we can help through our pipelines, but also through our advisory board, where you can make your connections directly, right? So, you know, looking to really support that as much as possible.
Yeah, and Carlos, I want to stay with you. I know you host an advisory, which again can build that partnership that we mentioned. So I don't know if you want to touch base on that. I know our team was involved in that earlier this week.
Yeah. So, again, that's our AHEC advisory board that we do hold quarterly. Really, the goal is to improve healthcare quality, you know, especially in rural and underserved areas. It is a nationwide program. I believe there are 10 centers in California and 3 in like the Los Angeles County area. So there's a lot of individuals that are working on partnering together and really bridging that gap, right, between the workforce, which are, you know, the potential workforce, which are in the schools, and the centers, at least for us, are member health centers that are looking to hire those individuals, right? So again, we like to bring on. We have co-chairs that represent both sides of the field there, kind of. We always speak a little about what we're doing, but one of the most important things, again, is we leave some time at the end for that partnership that can be built outside of us, right? So it'd be great if everything went through my pipeline program, my job would be done. But the most important thing is that, like, there may be some things that don't go through my organization, right? But I would love to be that branch between the two entities that are looking to solve the same problem. So, I do encourage it. I could send you guys the invite for our next one coming up in February, and we'd love to have as many individuals there. Really, just rowing in the same direction, I guess.
Thank you for that, Carlos, and thank you for allowing a space to continue that partnership. Adriana, Jared, anything that you guys want to inform the audience here?
Yes, so we have a lot of job openings for community health worker. Again, that one doesn't require high school diploma, but if they have it, that's great. Psychiatric social worker. We have a lot of job openings right now. So please feel free to reach out and get support.
And then I'll just plug our Careers and Health Mentorship program that I run. It happens every year. Applications open in 2025. It's usually set for a summer cohort. I see a couple educational institutions here on the call, so feel free to reach out to me. Again, it's a early entry level internship for healthcare administration and public health, and it's always a great time, and we get great feedback from a lot of different colleges. So feel free to send me an email if you want to learn more, or chat offline, and I'll be more than happy to.
Thank you again, guys. Now it's the fun part of where we involve our audience. If you can virtually raise your hand and I go down the line, I know there might be some questions here, so please feel free. The first one I see is the first one I will select, and then you can direct your question to a specific panelist or a panelist overall. If there are specific questions about data, then we can then offline connect you with our specialist and GIS specialist there. But I see Carrie, so the floor is yours, Carrie.
Thank you, Jose, and thank you to all of our panelists. I think all of you emphasize the importance of partnerships in diversifying talent pathways into healthcare. And I'm curious, on your end, as an employer, as someone who's hiring at the end of this talent pipeline, what kind of capacity do you think your organizations need to invest in to develop those partnerships at scale? Like, a lot of you have described really great programs that maybe just be serving 50 to 100 students. If you want to get to serving, there's 100 high schools with healthcare pathways, and every single high school student gets an internship. Every single high school student gets a career fair with a mental health professional. What capacity do you think you need to make those partnerships happen?
It's going to go back to the old resources side of things. As a nonprofit, we're really reliant on the funding and the support that we can get. That we're our everything we do comes from those that are investing in our programs, right? Even down to like the salary pieces of it. So I think if we had the capacity and the funding to be able to support, hundreds of students, we would do that. We would recruit that way. We would have the staff to really support those types of efforts and whatnot. And I think, again, like mentioning where we may not have that capacity, finding other organizations that do maybe have some capacity, or combining capacities, right, and funding and whatnot, to kind of multiply our efforts, I think would go a long way.
Yeah, great points. I actually would love to hear from Adriana and Jared as direct industry. Any thoughts on Carrie's great question on how can we scale that up? I know resources is a big component, but any other thoughts on that?
I totally agree. Like, some of the staff is a little burned out, and so it really we really need the staff buy-in, and they all love interns. They all really want to pay it forward and bring more people to our side in the field. So making space for them to be able to do that, supporting them is a challenge. But we're working on it.
I agree with both Carlos and Adrian. I think I love the combining capacity because, of course, if we had the types of resources and the staff to do so, I'm sure all three of us would support over 200 students, right? And trying to be able to find a way to continue as well, using our collaborations, whether it's starting small and building up or trying to create a specific pathway with both of our projects and initiatives that we have going on. I know there's certain intern initiatives, administrative intern initiatives that use the involvement of the current interns, right? So for example, if I wanted to continue using Ivan's help to help me pick the next cohort, it gets him involved and, kind of cuts off that resources because he already is kind of involved. So that's kind of one of the main examples, as well as continuing involvement from whether it's the partnership or the students that it brings in, and just make it full circle going around.
Thank you. Great points. I think what we heard was one, resources and funding, staff, and then Jared, a solution that you mentioned, I think was great, is continued partnership and building that and working together to offer more opportunities as a whole. If there's nothing there, create something, and we can start off as a pilot and then grow from there. So thank you for that. I see there is another hand raised, so please feel free to address your question.
This is Mr. Kim. I am Dean of College of Health Human Services at California State University, Dominguez Hills. And thank you for your wonderful panel and sharing the information. We have the same problems at the university level, resource issue. Like if you want to have interns, we need to have also internship program, work-based learning program at the university level to manage that program. We don't get funded for that. We are able to do it this year, and then we will continue next a couple more years because we received the funding from LAK sub-region. So that money is helping us to build this work-based learning program at Dominguez Hills. But continuing that to be able to connect with and network with your side of it, that's where we are struggling as well to our side. So I want to share that experience with you. But I have a couple questions. One is, like earlier presentation, it says entry level, we have enough BIPOC, like over 70% diversity there. But as it is going up, the diversity is kind of shrinking. And the leadership levels and as well. That leadership level requires advanced education, right? Like minimum bachelor's degree and master's degree, it's not doctorate degree. But a lot of those entry level the jobs, high schoolers are grabbed at the entry level before they go on college because there are some training programs free, apprenticeship programs, training programs they go on. And then after their training, they get that entry level education. And then our Dominguez Hills here at Dominguez Hill College of Health is interested in developing pathway with them as well, so that they have access to continuing education to advance their degree, so that they have opportunity to go up in their career. How can we develop that from all of you? That's my first question. After that, I can ask the second question.
Thank you. So I think the question is, how can we develop programs directly with the educational institutes? If that's correct.
Yeah, if they are at the entry level jobs, and working with you without bachelor's degree, then how do we develop the pathway with your employees to advance their educational path so that they can go on their career path, advance their career?
Got you. So essentially, is continuing to rescale your current staff. How can we do a better job of, if you have your entry level workers, how can we do a better job? And maybe Adriana and Jared, you and Carlos as well, of continuing to scale them up to make then sustainable wages. I know the medium wages in healthcare are over 70K, but there are some entry level positions that are not paying that. And how do we move those into those sustainable? Yeah. So yeah, panelists, love to kind of hear your inputs. Maybe there are some programs already there within your clinics and respective employers where there's already programs to rescale.
In my experience, we don't have like a formal way, but like when I have a community health worker that's interested in higher education, I send them to Cal State Dominguez Hills, Cal State Long Beach, CSUN, and they kind of figure out the classes, and then I adjust their work schedule to accommodate. But it's not like a formal process where the school and the department have established like a schedule. So it's more kind of informal.
I don't know, Carlos, you might not have any feedback on this.
Yeah, sorry, I have to punt on this question as I'm not the kind of the end hiring person. But you have seen this in different industries, right? And I think it's about the culture of the employer, right? And are they investing, right, the time and sometimes financial support to allow an individual to work and to learn at the same time, which could be difficult. So I think funding would be important, right? Finding ways that can allow maybe some financial support because, at that entry level position, maybe they don't have the capacity to take on more education, right? Financially, or they don't have the time to do so. So it's really about kind of building, I would say, those partnerships with the employers, because there's only so much resources that go around.
Yeah, I
Yeah.
think, go ahead, Jared.
Yeah, I just want to echo off what Carlos was mentioning, Adrian, as well as building the partnerships and allowing the presence of each of these individual institutions to kind of collaborate and continue partnering, whether it's going to the career fairs or working together with education institutions on a specific pipeline program. I wish it was as easy as saying yes, right? But there's also so many processes and ways to kind of navigate through it all, and I think that sounds an amazing opportunity to do so. It's something that I wrote down to bring back to leadership and see how we can build for the future of that, not only just with you as Dominguez Hills, but with other educational institutions. Thank you for your question.
And
Absolutely.
no,
Go
I
ahead.
just wanted to add real quick. I think that was a great question because, one of the things that Carlos mentioned is a lot of the time we don't know here as LA County employers, participants, students, the resources that are out there. So there is funding directly for employers, and maybe Carlos, you can segue that to the clinics that you work with to allow individuals who are currently working to continue to get that training, and you can partner up with the educational institutes to offer specific training that is needed to allow them then to continue to grow. So the funding is there specifically for that thing. So, we'd love to continue this partnership and see how we can definitely, like Jared mentioned, build those programs and allow some of your current workers to continue to scale up, because that's how we close those workforce gaps, right? And that's how you build, that community relationship with the community by, offering these promotional opportunities and, the ability to grow within your organization. But Ms. Kim, I know you had another question, so we probably will
Yeah.
allow for two more, and then we can segue off to the next topic.
So my second question is related to linguistic competencies that came out a couple of times. So in the presentation, 53% of workforce are Hispanics. And in our LA region, about 50% of populations are Latinx as well. So what kind of effort going on at your side in terms of really ramping up second language competencies? Number one is Hispanic, no, not Spanish, that our campus is working on at the moment. But the first question related to that, do you really need? Is there high demand in terms of second language of your employees? And if yes or no, but do you have any effort going on your side to be able to really enhance the need of second language skills of your employees? It could be a Spanish number one in LA region. It could be another language, Korean, Japanese, Tagalog.
Yeah, great question. So the importance of understanding a second language. I think in LA County, there's over 200 languages spoken. So I don't know if there's anything specifically to Ms. Kim's question that you guys' organization is doing to promote that. And then, yeah, Adriana, I think you unmuted yourself.
Yes, so for our community education program, our goal is to provide workshops to decrease mental health stigma in different languages. So in the past 4 years, we've really increased our workforce with Korean, Chinese, both Mandarin and Cantonese, Arabic, Khmer, and Tagalog. And we're looking to get Thai, Vietnamese. We're looking for more of the Asian languages. So we have had in the past job bulletins that said, you know, specifically for Korean, Chinese, or, you know, the threshold languages that we don't have yet, like recruiting for those languages. If someone comes in with that language, they do qualify for a bilingual bonus if they pass the bilingual exam. So that's another incentive. And really the goal is to provide these workshops in native languages because stigma is so huge in underserved communities and it's a barrier for them to access care. And Nellie, we're very lucky and blessed to have so many mental health resources, but our underserved communities are not utilizing it. So that's the goal. Thanks.
Great points. Jared, Carlos, any input or?
Yeah, I would just say what we focus on is really our targeted outreach, right? And focusing our like a lot of our recruitment efforts, you know, in schools and the surrounding communities that represent those populations. You know, with 65, you know, community health members, we have, you know, different locations that require different languages, right? Depending on where they're located. We, you know, on all of our applications, we're asking for that information. We want to capture that information so that way when we are looking to match our interns or fellows or whatever it might be, that they're able to utilize that as a strength, because normally the health center will be looking for that as a preferred, you know, qualification. So we're looking to capture that information in our recruitment efforts. We want to really recruit in those areas, and then once that individual proves, you know, eligible for the program, matching them where they'll be the most effective.
And then I guess from my perspective, in regards to, you know, the Careers in Health Mentorship Program and, you know, other workforce programs, there has never really been the type of approach where we to really specify, you know, certain languages. We just accept and interview everyone, and, you know, also we, you know, try to go through our different resources at CHLA, whether it's our promotoras, our family resource center, you know, our different English and language specialists help us out. And in the past, you know, the program has been going on for 10 years, and, you know, we tried to be as inclusive as possible, you know, making our requirements as open as possible, and, you know, even on a case-by-case basis, working with foreign exchange students that want to get entry-level workforce opportunities. So I think that's a great question to bring and also incorporate for the future of, you know, the program that I run and whatever programs that we have currently and what we want to have. So that's also a great question as well. Thank you so much. I'm taking notes from you.
No, thank you so much, Ms. Kim. Those are great questions in specific with equity and how we're doing as an organization and specific employer partners, what they're doing to make sure that we're honing in on those demographics and populations as well. So once again, thank you so much for your partnership, Jared, Carlos, Adriana, and Ivan. I think your feedback was so important, and it was great to hear some of your comments. We hope to continue this partnership moving forward. We hope to maybe then next go around, maybe do something in person with you guys and see how we can continue this and this partnership as mentioned. So with that being said, I'll segue it to my colleague Pablo, who will be launching a poll and survey about our current advisory. So Pablo, the floor is yours.
Thank you so much. Great discussion, and thank you so much to our panelists. I'm sharing a Zoom poll / survey with everyone here. We have 33 participants on the call. It'd be amazing if we could get 33 responses. Really, this is just a quick, you know, quick little homework for you all to just to better understand, you know, the effectiveness and also some of the things that we can do better. Let me see. I see some people saying that they are unable to see it. Let me go ahead and see if I can redo it. Okay. If I end the poll, it may cut people out. I can send it to you directly, Danielle, afterward as well. So just to get your input as well. I think Harry can see it, so that's great as well. And don't go anywhere after you fill out the survey. We do have one more speaker for you all today to help us close out this advisory on healthcare. Let's see. Perfect. I see a lot of participation so far. Thank you so much. I really appreciate it. These are linked all together, so it's just an aggregate information to help us understand where to take the next one, the next advisory. We'll leave it up for a couple more minutes here, and then we'll transition through. All right, excellent. Nice. A lot of participation. That's awesome. All right, excellent. So I'll go ahead and give you 30 more seconds to finish up the poll. Looks like we got a lot of people in already. That's great. And we can go ahead and share that later as well. Perfect. And now it's with my great pleasure to introduce, here to give our closing remarks for our healthcare advisory, is Terry Hollingsworth, the Vice President and of Human Resources and Educational Services at Hospital Association of Southern California.
Great. Well, thank you so much, Pablo, and that was a great panel. The panel really underscored a lot of what we are hearing at the Hospital Association regarding some of the barriers, challenges, and opportunities. But for those of you who may not be familiar with the Hospital Association, we are a regional trade association representing over 170 hospitals across the Southern California region. We cover 6 counties: Los Angeles, Orange, Santa Barbara, Ventura, San Bernardino, and Riverside. So we are an advocacy organization. We also provide products, programs, and services to our member hospitals to help them deliver healthcare services. In my role as the VP of HR, I'm responsible for a number of things, including the production of benchmark reports, HR benchmark reports, education programs to help member hospitals upskill their existing workforce, and workforce development. So in my role in workforce development, I'm out in the community engaging with many of you all who are on the phone on this call today. And I see some familiar faces. I see Misuk, and it's good to see you, and Par, and a variety of others that are on the line. Simply put, workforce development is a team sport. If you think that you can go at it alone, you're wrong. We need each other. We need each other. And, you know, this collaborative, the work that this collaborative is doing is very, very important. You know, we see a lot of challenges that we alone, even as a trade association, can't solve ourselves. And I just want to highlight on some of the challenges that I'm seeing, and I appreciate the panel sharing, you know, their challenges as well. But some of the hard to recruit, difficult to fill positions that our hospitals are experiencing, and just to name a few, of course, the top of the list would be registered nurses and some key specialty areas. Clinical laboratory scientists, Misuk, we partnered with Cal State Dominguez Hills on that, and we'll continue to partner with them on that. CNAs, really during COVID, we really saw the height of this shortage, and it continues to exist today. So we're really trying to understand exactly how to best position ourselves in terms of addressing this issue. Surgical techs, that's another issue. We're seeing gaps in training programs across California, and so we need to really address those key areas. Occupational therapists and physical therapists. That's another key area that we're finding. And, again, we need each other to address these shortages. But some of the issues that have come up as we work with our member hospitals and our academic institutions to address workforce shortages includes faculty shortages. Many of our academic partners are experiencing shortages of faculty. Some of it has to do with pay. And I was on a call earlier today with the California Hospital Association, our partner out of Sacramento, looking to really take this issue up in 2025, because we really need to remove that barrier so that we can increase enrollment and graduate more individuals through these programs. We're also seeing, someone mentioned about preceptors and burnout. We need to find a way to support those individuals that are in our hospitals providing training to these students. And then we have, we need to work together to ensure that the training programs that our academic partners are providing align with the needs of our employers. And that's the work that we do at the association, is that we serve as a convener. We serve as an intermediary. So if ever you're trying to get to a hospital or you're experiencing challenges, feel free to reach out to the Hospital Association. We'd love to connect you. But the other big elephant in the room is the shortage of clinical placement sites. And that's there were key legislations that were approved recently. But as with most legislations that's been passed, it takes time for it to really make an impact. And so we're trying to really think through on how we can make a difference in this area. We hear about the shortages of clinical placement sites, but we can't really quantify it, because there's not just one clinical placement system used across the state, there are many. And so that's an issue that we're looking at. So many of the issues that our panelists shared, ditto here. We're finding the same key issues and challenges. But again, we're in this together. This is what this K through 16 collaborative is all about, is that we work together collectively to find a solution that will benefit not just our industry partners, not just the schools, but everyone, the entire community. And diversity is a key issue for us. We have a number of programs that we offer at the association. Scholarship programs is called the Diversity in Healthcare Scholarship Program, where we offer scholarships for those who are currently enrolled in accredited programs, as well as stipends for those who are serving as interns in institutions. So we have some skin in the game at the association as well. So, again, thank you for today's coming and joining us for today's presentation. Again, if you don't leave with any other word in your mind, leave away with the word partnerships. We have to partner together, collaborate together. We've got to work together. So I appreciate you all joining us today, and I'll pass it back over to our next speaker.
Excellent. Thank you so much, Terry. And with that, I believe we will conclude our advisory. Thank you so much again for your participation, your expertise, and your willingness to collaborate. We'll be sending out by the end of the week a wrap up with all of the information shared today, so that you can stay connected, stay informed, and we thank you very much for your time.
Thank you, everyone.
Thank you all.